Hello, this is Mr. Verera, and this is the final video in section 5, Reducing Addiction. And this is just simply looking at cognitive behavioral therapy, or CBT. What we can just remind ourselves is that there, of course, is a cognitive basis for addiction, that somebody's cognitions or cognitive errors may lead to their addictive behavior. And of course, their thoughts could get them to potentially try and get them to behave in a particular way. And then, of course, that's typical ABC model where things kind of go worse and they kind of go back to their thoughts and things like that. But of course, we need to not forget that there's a behavior aspect of this. And of course, with the behavior aspect of CBT, we can obviously talk about the behavioral side if we have a behavioral essay. What we can say is that CBT, I think, is an effective treatment in many ways. We see that the main goal is the following. It says here to change the way we think about the addiction and to learn new ways to cope with circumstances. I know you probably could say that is the main two goals of CBT. But that does highlight an important aspect of CBT that we need to know. Even though we're dealing with people's cognitions, there are cognitions into the behavior. So why do they behave in that particular way? Not the underlying reasons for the addictive behavior. It's kind of why do that. So they might say, "Oh, I have no friends, and that's why I drink." And then it's kind of breaking down that logic of, okay, so you have no friends. Let's have a look at that and let's see kind of how it works. So please, even though I think it's a positive form of treatment, it's going to have its limitations in terms of if it doesn't treat the underlying cause, then what will? We don't have any psychotherapy models to look at for the specifications. So kind of think about kind of the big picture of all the treatments and specifically kind of where this is going. So let's go through how CBT works. What we do find is we typically have about 10 hours of therapy. It's a lot different to anything else before because there's three components of it. I often say it's the C, the B, and the T being the therapist actually playing an active role in this. And in these sessions, we find that the individual is asked to think and to talk about their feelings of what they do when they engage in particular addiction, and then also kind of look at the behavior that could help them in the future. You can have CBT long term, but of course, the 10 hours is kind of there. It can be face to face. You can actually do workbooks as well. It doesn't, but it is a much more active form of therapy. The NHS typically funds about 6 hours of CBT for adults. So let's look at the three parts. I've labeled them ABC. So the first part is literally this idea of identification. So what is going on in the person's cognitions that makes them think that they need to do the particular behavior? So what are the cognitive biases that may exist in the person? And so the therapist takes an active role in trying to unpack and to educate. I think I have some kind of comment later about how the therapist potentially helps the client see the underlying assumptions that they've made about their addictive behavior, and literally to point out the inconsistencies. So Ladouceur here said a major role is to educate. So Ladouceur, the same person who was part of our cognitive explanation of gambling. And of course, it is likely that the person who is a gambler, a person who is an addict, may not actually have clear thoughts about their particular behavior. We also, I love this question, asks how effective their strategy has been. So pretty much when you are engaging in addictive behavior because of whatever cognition may be, how's it worked out for you? Clearly, you wouldn't be here if it had worked out perfectly. It's kind of the underlying assumption with this. So it can be incredibly hard, this, but of course it could also be very helpful as the client gets to understand a bit about their behavior. The second part is perhaps one of the harder parts here. We get this idea that once you've kind of unpacked your cognitions, you can restructure them, and you need to think differently about your problem behavior. So, what we might have is that the person gets given a diary, which they have to start recording what triggers they have for their particular problem. So, it may be obvious to you or me, maybe obvious to the therapist, but it may not be obvious to the client that if they say, oh, on Monday this happened, and then the following happened, and 3 hours later I found myself drinking too much and things like that, they may not kind of understand how the two different behaviors might well relate to each other. And therefore, keeping a record of their behavior is often a tough thing to do for the addict, but can certainly help them kind of understand kind of what it is that they need to potentially avoid. And it's not obvious to everyone that certain behaviors are triggered by certain things. So just walking past the corner shop, every time I walk past the corner shop, I go in, I get myself a chocolate and buy myself a scratch card or something like that. And you can see how those two behaviors may well be linked to it. Then the last section is about relapse prevention. This is obviously a very positive um, route as well, and once again requires a bit of effort. So learning to avoid those risky situations. So therefore, if I walk past the corner shop, maybe just find a different route home, or kind of find ways in which I can stop myself from intuitively kind of just accepting that I go into the corner shop to buy a scratch card if that's the issue in this particular case. So we see this treatment for gambler that they might identify places potentially that they need to avoid or to kind of be wary of. Maybe some feelings like when they're feeling down or happy or bored or whatever it could be, and also then other kind of difficulties that might happen. So I think it's clearly quite an active therapeutic session that the person find themselves in. So on the one side, we have the cognitive. We have to unpack and understand our cognitions toward the addictive behavior. Two, then we're going to identify the behaviors that are potentially problematic, and also then how can we change those behaviors in the future. And this is all done through the therapist, who clearly kind of plays like a project management kind of role, looking at putting things together, helping the client put things together, and things like that. So overall, it's a good form of therapy, but it's not for everyone, and certainly because we're going to find that not everyone actually will finish CBT because it's hard. Now, the big picture here is that I don't kind of look at an overall idea of reductionism or um, or determinism. And I suppose determinism could be used because this whole idea that I might actively choose not to continue with the treatment. But there's quite a lot of research support actually that it's effective. I like the word effective. You should try and use that in your evaluation points. And so they compared this with a control group and people before they were um, in the program, they were diagnosed as having gambling problems, and we see that if they're finished, that only 86% of them, or sorry, I should say 14% of them were still regarded as pathological gamblers. So there's quite a lot kind of good there. They also kind of spoke to them about their cognitions and understanding of gambling, and we see here that they had better perception. So we see that if the person does go through CBT, that there's kind of a really good chance that it will be effective. We also know that Petri does very similar has very similar findings, and does the same type of idea, looking at whether a year later that they still are in the same position as they were after treatment. However, they also looked at whether face-to-face versus a workbook was more effective, and I think it's kind of obvious that face-to-face is going to be more effective. And I suppose you and I both kind of know this, that if you have to meet somebody and talk about something that you've done over the last week, you're more likely to kind of think, oh, I need to do this kind of idea. But what is quite interesting is that this is research support that has a long-term effect. But what you find actually, there is some question over whether long-term effectiveness of CBT is actually there. And what they looked at is a group of people who had been through CBT in reducing their gambling behavior. And actually, after 3 months, it was brilliant. But after that, unfortunately, we see here, however, after 9 to 12 months, there was no significant difference in the outcome between the CBT group and the control group. So it's not to say that the control group were worse, not to say that these people went back to worse behavior, but maybe that after 12 months that the behavior wasn't any different to people who hadn't received treatment. And that's quite frightening. And I suppose it goes down to this underlying idea that the CBT may not look at the person's underlying addictive behavior, and that I think is incredibly problematic. So we could say it's not effective long term, not effective long term. And that's kind of, as I said, worrying. Whether it's appropriate, I think it certainly could be appropriate, because somebody who needs to modify the behavior certainly will find it hard to do themselves. And so therefore, putting them on a CBT program is probably quite a good thing. We could add to this idea, so this is further complicated by research that shows that the dropout rates were up to 5 times greater than any form of other therapy. And I suppose that's down to the hard work. So you could kind of make a whole kind of negative point here, where you talk about the difficulty of CBT and finishing it. It's only worth doing if it's face-to-face, only worth doing if you finish it, and the dropout rate is quite high. So you could ask whether it's valid to give CBT to addicts, and I suppose part of the question is to say no. Maybe what we need to look at is how would you treat an addict using CBT? I'd certainly kind of consider what their addictive behavior is, kind of how far along they are, whether they're sober or not, whether they have the desire to want to actually finish with their addiction. And if they do, the chances are that CBT will be more effective. Now, it's not exactly a long section once again, so please do look in the textbook, make sure that you have enough to write an essay on this. I'm going to show you a few questions. So we see the first question is just a short 4-marker. Please be familiar with this. You need to be able to write down quite quickly, one method of reducing addiction, and you've got to think, okay, how much detail do I need to give? I have to show the mechanism, actually I have to explain kind of what happens, for 4 marks. And then obviously that's 2 marks for the method and 2 marks for limitation. But we also have quite a tricky question here. Second one says outline and evaluate one psychological intervention. So psychological can be CBT and behavioral. Just kind of be clear on what you're talking about. It says one, so you need to be very clear there. And the last one says one type of intervention. I suppose the only tricky business with that is you've got to be really clear of the type of intervention. So there's behavioral intervention, there's drug therapy and CBT. Because if I'm too specific about drug therapy and I talk about one drug, I'm not going to have enough. So I need to talk about drug therapies, also need to talk about both aversion treatment and covert sensitization. Though, of course, the last one is to remind ourselves of the applied type of questions. I quite like this particular question because it says identify one or more interventions, which could explain the smoking. So in other words, this is not about evaluation. We don't need to give the evaluation points here. We just need to explain it. Now this is quite clear. We don't have to have different interventions. We just need to have ones that are appropriate. We find this whole idea of she has started to despair. So therefore CBT could be relevant for that one. We also have experiencing unpleasant withdrawal symptoms. So we have NRT. But you can also perhaps look at other aspects. If we look at this idea, she's keen to give up, so therefore she's motivated. The chances are we could use CBT for that, or we could use some kind of aversion therapy or covert sensitization in order to work that one through. So I hope you have enjoyed this. I keep on doing the videos there for you to help with your revision and certainly with your understanding. The notes, of course, are on the Google Drive, so please have a look at those. And that's all